What is the role of religion in our ever-changing world? From the NewsChannel 5 network, this is Issues of Faith.
Hello, everyone. Welcome to Issues of Faith. So glad you are with us. We are talking today about COVID in the Nashville Islamic community and efforts by Muslims and mosques to help get Muslims vaccinated. What are some of the hurdles and what's being done specifically in the Muslim community? Very happy to have with us Sabina Mohyuddin, who has been with us before. Sabina, thank you for being with us.
Well, thank you for having me today.
You have a great bio that I'm going to get to in a moment, but you're the executive director with the American Muslim Advisory Council. We'll talk about that in a moment. But I want to ask, first of all, just about the impact of COVID on the Muslim community here in Nashville. What have you seen here in our area?
So initially, and again, thank you for having me here today. With the American Muslim Advisory Council, we work to empower the Muslim community across Tennessee. And when COVID hit, we weren't really in the space of helping our community through a pandemic. So we really had to shift, because what we were seeing was that our community was living in areas where there were COVID hotspots. Yeah, so in those initial few months in southeast Nashville, along Nolensville Road and Murfreesboro Road. And so we realized that we had to work to educate our community about COVID, the risk, how to stay safe, whether it was on masks. And what we came to understand is the best way to educate our community is through the leaders and the influencers, and sometimes that's mosque leaders, and sometimes that's ethnic or community leaders. And so getting the mosques to close when everything was closing down and send that message out to the community: stay home, stay safe, wear a mask. So we kind of, AMAC kind of transitioned, and we kind of worked to respond and to really check in our communities, what was needed, besides the education piece on COVID, what were the financial resources that they needed, how were they being affected by all these closures, and how could the city better respond to the needs of our community. And
so now here we are in the phase where we're doing vaccines. And so big picture, what is the history of Islamic thought when it comes to vaccines in general? So there's a great quote by Prophet Muhammad, peace be upon him, that says, you need to tie your camel and then put your trust in God. And so that idea that, of course, God is in control of everything, in control of our lives, what happens, we know that. But at the same time, he requires us to take the proper precautions or proper steps to safeguard, keep ourselves safe, our community safe. So vaccine is about prevention of diseases, and also in Islam, it emphasized that you have to take care of your body because your body has been given to you as a trust from God. So we use the word amana. So it's a trust from God that he has entrusted us with this body, and it's our responsibility to take care of it. Taking care of it is taking care of our health and well-being, and vaccines are a big part of that. And so actually in the United States, we have the Fiqh Council of North America, and they make religious rulings for North American Muslims to understand how to follow the Islamic rules, while living in the U.S. So their ruling came out saying, encouraging everyone to take a vaccine. And I think that was very important, because it wasn't just for individually taking care of your own health to prevent yourself from getting COVID, but it was also a matter of, we have a responsibility to take care of our community. And that's actually, many times in Islam, the responsibility to take care of our neighbors and our community comes first. And so this is one of those situations where we want to achieve herd immunity, and you're not going to do it if we're all thinking about ourselves alone. And so we have to think about the community, and that's why they encourage, they're not requiring, but they highly encourage everyone get the vaccine.
And do they have to overcome some past historical hurdle? I mean, obviously, people of all faiths, they're concerned that there's skepticism about the vaccine. Is there anything unique to the Islamic faith that would make Muslims perhaps more concerned about something like a vaccine and a hurdle that you're having to overcome?
Oh, yeah. I mean, and it's the same kind of myths and misconceptions spread and rumors spread on the internet that a lot of people, regardless of faith, are seeing, right? That mRNA, I don't know if I'm saying it right, but that the vaccine will take over your DNA, or there's a chip in it, or something. We've seen those rumors, go around Facebook, and people having doubts, and with these, historical surveillance of the Muslim community, that brings out some of their concerns. Also, as Muslims, we're forbidden from eating any pork or pork products. And so rumors have come out that there might be pork in the vaccine, which is totally false. So it's, we're working on addressing those rumors. But the rumors are one part of it. Another part is how seriously are people taking COVID disease, the disease itself? So in the community, and we know across the country, vast majority of people who get COVID don't get seriously sick. And so people have seen, so-and-so got COVID, they were okay. Like, why would I risk myself for a vaccine when I can get the disease and it's not so bad? And I think that's a challenge within any community. How do you overcome that and explain that, yes, most people are okay, but do you want to be that small percentage of people who end up at the hospital and think of what would happen to your family? So, those are issues that we're having to deal with, to take the vaccine seriously from a religious standpoint, thinking about not just yourself, but for the community. Everyone wants everything to open up 100%. And, being able to go without masks, go to restaurants, and go out. And there's just, for Muslims, I think, there's a special reward that with the month of Ramadan coming up, it starts April 12th. Normally, Muslims flock to the mosque, for the evening prayers, they break fast together after the evening prayers, and then their nightly prayers. And last year, COVID hit like a month before Ramadan, and all the mosques were closed, and that was really hard to take. It was hard to see, because this is always an exciting time of the year for our community. So that's one of the reasonings we're trying to use to get people, like, if you get vaccinated, hopefully we have some semblance of a more normal Ramadan. I don't think it will be, what it was 2 years ago, but still we would be on our way. And at the end of Ramadan, we celebrate with the Eid celebration. And, the last year's Eid celebration, everyone was at home. So we're looking forward, trying to get our community vaccinated so they're not at risk when they go and celebrate Ramadan.
Yeah, absolutely. And so how are mosques open now? Where does that stand? And what role will mosques play in encouraging people to get vaccinated?
So the mosques are open, but they've been open with limited capacity. So trying to keep with some of the CDC recommendations that people are praying 6 feet apart, wearing masks, getting temperature checks before they go. A lot of the mosques have registration because they only have so many spaces available for prayer. So, we've been working with the mosque since the beginning of the pandemic to make sure everyone is following the proper safety procedures. So now with the vaccines, again, like I mentioned in the beginning, that it's very important who's giving the message in our community. So the message, when the messaging comes from mosque leaders, from the imams, or ethnic and community leaders, it has more weight. And so we've been working with the Metro Health Department. We've also worked with Neighborhood Health and Salome to make sure that our community knows about the vaccines and are getting vaccinated. So, initially when the vaccines came, especially for 75 and older, the sign up was online, right? And within a day, all the spots were filled. So, we know in our community, especially in the elderly population, they don't have that, easy access to internet and social media and doing things online. So like for myself, I signed up my parents, I was on top of it. Because of some of those barriers and how much our community is actually watching the local news and keeping up with when these vaccines are being rolled out in different phases. How well are they keeping up? So we were working with these clinics and then the Metro Health Department, and actually, so March 11th is there's a vaccine program going on at the Saladin Center. So it's the mosque that serves the Kurdish community, and so that community is about 20,000 people. So and it's been great because when it's at a mosque, it sends a message to the community members that the vaccine is being endorsed by the mosque leaders, is being endorsed by the imam, and also the mosque it's like home for people. It's a safe place. It's a familiar place. So if you're to ask somebody, would you rather go to Saladin Center, a place they know, or the Music City Center, place they don't know, they don't go downtown, confused about downtown traffic and parking, they're going to say Saladin Center. So I think this is a great collaboration with the Metro Health Department to get it. And also, we've been working to really reach out to individual community members who could qualify for the vaccine. So, again, you can have things on the news and on social media, and it's missing a lot of people. And it's that individual call or email or word of mouth that goes out that has a lot more effect on people. And
right.
We're also going to do another one in April with the Islamic Center of Tennessee.
Very good. All right, we're gonna take a break, and then I want to come back and talk about a program you launched a while ago about interfaith dialogue. So we'll take a break, come back, continue the discussion. We'll be back right after this.